Psychiatric care is ineffective. Well, at least if we're talking about the care of acutely suicidal depressed patients on the inpatient psychiatric unit. Now, what happens in these cases is these people are often committed, possibly against their will, to an inpatient psychiatric facility for quote unquote treatment. Now, what normally happens is they're kind of locked away in this unit for an arbitrary length of time. They attend group psychotherapy, and they usually get treated with the standard types of medications that we would use for depression, be it bipolar or unipolar depression, depending, right? So this individual is going to get treated in that way. And of course, that is going to have no impact on suicide. So this is a significant problem. And the issue that comes into play here is that we know this is ineffective, and we actually have evidence-based treatments to treat suicidal depression. So why aren't we using them, you might be asking me? Well, I love that question, and I'm going to answer it for you guys here. So the first evidence-based treatment that we have was approved in 2020, and it's called Eskatmaine or Spravoto. Now, this was approved by the FDA for adults with major depressive disorder and acute suicidal ideation or behavior. Now, this looks like the ideal medication to administer in the acute setting, such as an emergency room or possibly an inpatient unit, right? Makes sense. Well, there's a significant problem. Nobody can get paid to do this. So you can't get paid to administer it in the hospital. Now, I've asked about this on my own unit because I would like to have this life-saving treatment available to me, and I do not have it. And the reason I don't have it is because of money and insurance's inability to pay for it. So that's one piece of it. We don't have Eskatmaine, evidence-based treatment for acute suicidality. Okay, the second one is actually one that's been around for a long time, but still has a ton of stigma and apprehension on the part of the patient. And that is electroconvulsive therapy, ECT. Now, I do a lot of these cases myself. I provide ECT. And what I find is that many patients who are appropriate for this treatment will not do it because of stigma. They do not want to be stigmatized by this type of treatment. They don't like the idea of quote unquote my brain getting zapped. People don't like the way it works. And there's a lot of negativity around it. So of course, people don't want to do this treatment. That's a significant problem considering we know that ECT treatment in depressed suicidal patients is highly effective. So we lose another very effective method of treating people due to stigma and sometimes to social factors like inability to gain transportation to the location where the ECT will be provided once they are discharged. So that's a secondary factor, not necessarily related to the first issue, but stigma is a big problem here with this treatment. So what we could say in conclusion here is that we have two evidence-based methods for treating depression with acute suicidality, and we are not using them for two very different reasons.